Hello, everyone, and thank you for joining us. I'm Michael Castillo. I'm the new communications director for the Alzheimer Association here in Northern California and Northern Nevada. We're here to talk to you about everything that's coming out of the Alzheimer's Association International Conference happening this week, otherwise known as AAIC. And we have the wonderful and multi-talented Claire Day joining us here today. She is our Chief Program Officer and our research champion here for our chapter. So how's it going, Claire?
Well, Michael, first of all, welcome to the Alzheimer's Association. I know you're not new anymore, but as our new Senior Director of Communications, it's certainly great to be with you here on our first AAIC Facebook Live. Normally, we would be together, right, if we weren't social distancing and being really safe. And we would potentially even be in Denver or wherever AAIC was being held. So pleasure to be with you today. I wish we could be in person, but really happy to be able to provide some of the latest and greatest with our watchers here.
Well, thank you. Yes, it's great to be a part of such a great organization. And yeah, there's lots of great stuff happening this week at AAIC. So let's dive right in.
Sure.
So I've heard that this is the first year that it's been a hybrid model of in-person and virtual. How's that going?
Yeah, it's really interesting. What I love about the association is how nimble we are. We're able to adapt to whatever is going on in the world around us. And, we were last year completely virtual, and this year excited that the silver lining of some of the pandemic and travel restrictions being lifted in some areas is that we are able to offer this hybrid. So there's about 12,000 people registered for AAIC across the world. And there's about 1,200 of them that are actually meeting in person in Denver following some of those safety, social distancing and masking mandates. And so what was great is that it was because of this new virtual world, we were able to really offer a broader registration to attendees, to researchers, especially those from some low and middle income countries. About 49% of those 12,000 virtual attendees come from some of those low or middle income countries that in the past would have never attended the fully in-person sessions. And as usual, women are leading the way with attendance. 57% of attendees are women, and there's almost 200 attendees just from our chapter territory, so Northern California and Northern Nevada. And there's going to be some opportunities for people to start to see some of these recorded. So if you're registered and you weren't able to attend all of the sessions live, there's some playback as well. So it's really kind of exciting to see how the world has modified and adjusted accordingly to be able to keep life moving forward.
Yeah, definitely. And we'll definitely tell you guys how to find some of that research online later on during our program. And if you're just joining us, once again, I'm Michael Castillo, the Senior Director of Communications for Alzheimer's here in Northern California, Northern Nevada. And we're here with Claire Day, our Chief Program Officer and Research Champion, talking about all things AAIC happening this week. So let's start with the global impact of Alzheimer's. I hear that there's some research coming out related to the global prevalence and how that's going to be impacted over the next several years. So what can we see about that?
Yeah, so let's level set a little bit and talk about what we mean by prevalence. Of course, is that number of individuals who have a disease at either at a specific point of time, that's the point prevalence, or over a specified time, so the period of the time that they have a disease. And I think what's important with prevalence is it's not about new cases, right? So prevalence talks about both new and existing cases of the disease. And what some of this new data showed us is that it's estimate that a forecast of global dementia prevalence is actually going to triple to 152 million people by 2050.
Wow.
So I know, right? That's like, right? So these estimates were really made by the Institute for Health Metrics and Evaluation at the University of Washington School of Medicine. And I think it's just important as we start to think about what that means for future research, for effective treatments, but also thinking about what do we all need to be doing to reduce our risks. There were some studies that came out that talked about upward trends in things like smoking and BMI, our body mass index, high blood sugar, high blood pressure, all of those things that we consider to be what we call modifiable risk factors, right? Lifestyle changes.
Right.
So while there's some aspects of this disease that we can't control, we're seeing more and more of this evidence about the things that we can. So it leads us to think about those modifiable risk factors and what we should all be doing to lead a brain healthy lifestyle.
Yeah, definitely. I heard there were some differences in the US among urban and rural communities that also was a part of this study. Can you elaborate on that and what that might mean?
Yeah, it's really interesting. We see so much science data come out of AAIC. We think of science for Alzheimer's and dementia as cure, right? Or effective treatments. We think of it as how do we stop the disease? How do we slow the disease? But at the same time, there's all this research that comes out of AAIC around other contributing factors, which we've learned over the last decade are just as important, right, as plaques and tangles. We talk a lot about those hallmarks of Alzheimer's disease, but it's also learning about some of these other things that are impacting risk or changing risk and that we never thought of before. So in this particular study, mortality rates for Alzheimer's were highest in rural areas in what they consider the East South Central region of the United States. This is where they saw death rates from Alzheimer's at about 274 per 100,000 people in those who are over the age of 65. So this was specifically looking at people of what we would consider to be not the younger onset, but sort of the typical onset of the disease, which is 65 and older. And the lowest Alzheimer's mortality rates were in the Mid-Atlantic region. So we're starting to see evidence that dementia disproportionately impacts rural communities, especially in that sort of US South area. This also is where we see lower socioeconomic status. We see higher levels of other chronic diseases and less access to health services, including primary care. So when we think about the prevalence studies where we talk about things like smoking and high blood pressure and high blood sugar, we also have to think about who are people that are not accessing primary care and getting those regular health checkups and putting ourselves forward. These factors might all influence the differences in mortality rates. And individuals who live in those areas are also disproportionately people of color who are more likely to develop Alzheimer's disease. We know that Blacks are 2 times as likely and Hispanics are 1.5 times as likely to develop. So again, these when you look at all of these things together, it shows us these patterns of where we need to be focusing on access to healthcare, access to primary care, and just sort of overall brain health.
Yeah, definitely. And I imagine there will definitely be more research into this, aspect of it as we go on. I think those are all interesting findings that, warrant more research into those topics. So, yeah, if you're just joining us again, we are here talking about AAIC. I'm Michael Castillo, the Senior Communications Director for Northern California, Northern Nevada chapter. And we're here with Claire Day, our Chief Program Officer and Research Champion for the chapter as well. Diving more into the research, I've seen some news lately about the potential long-term effects of COVID-19 on the brain. Has this been discussed at AAIC?
Yes, well, as you can imagine, it has been a hot topic of researchers for a couple of different angles, right? There's just the long-term impacts of COVID-19 infection on the brain in general. And then of course, people are asking the question about what about people with dementia. And so there has been some studies. These are, of course, it's important to recognize early studies because they've only been happening for the last probably year.
Right.
But it is also amazing to see how scientists can rally together to really be able to study some of these hot topic type things when they come in. And so first, I think one of the coolest things that came out of the pandemic from a research side is our role, the association's role in an international consortium on COVID research. So last year, the Alzheimer's Association International Cohort Study of Chronic Neurological Studies of SARS. So of course, COVID is and I sometimes get this mixed up, but COVID is the infection, right? And SARS is, or COVID is the overall, it's the umbrella term, right? And SARS is the actual infection. I think that's how it works. And
Sure.
so what we did, I know I'm not a scientist. I just play one at work.
We'll roll with it.
Exactly. So, and I'm sure Michelle in the chat can correct us. But so what scientific leaders, including leaders at the Alzheimer's Association and representatives from more than 25 countries, pulled together with technical guidance from the World Health Organization to track the long-term impact of SARS, also known as the novel coronavirus or COVID-19 on the brain. And so what we were able to see, like other viruses, there is a similar like SARS and MERS, there are similar associations between infection and cognition. But I think there's still a big question about cause and effect. And so the ongoing pandemic really kind of gives us that unwelcome opportunity to really study the impact of these viral infections on the brain. And so there's potential viral contributions to Alzheimer's and dementia really have been long debated. And so no research to date has shown definitively that a virus can cause Alzheimer's disease, but they can also use this opportunity to really research both the short and long-term impacts of cognitive decline on the brain. And so it's really been a great opportunity. We know that, we've seen an increase in deaths of Alzheimer's because of COVID-19. And I think there's a lot of potential. It was, I think, a 16% increase in death, whether it's because of the infection, whether it's because of what the infection does to our overall system, whether it's because of isolation. I think there could be a number of reasons why we saw deaths in Alzheimer's go up this year. And of course, if you're interested in some of this research, you mentioned, Michael, the opportunity to dive sort of into this, if you're a real science nerd and geek like we are, through the Alzheimer's Association Science Hub app, or even through our website, alz.org. It has really the details of some of these studies, if you're interested in that sort of level. But I think the other thing is just understanding how that impacts the sort of status of Alzheimer's and dementia by our facts and figures. We saw some of the reports of those come out earlier in the year, in the release of the 2020 facts and figures. I guess it would be 2021 facts and figures. So
Right. Yes.
In March.
2021. Yes, it seems like it's been just one really long year. But yes, and as you said, it's amazing how quickly the scientific community has come together to be able to study the impacts of COVID-19 related to Alzheimer's. And, we're just scratching the surface here. There's going to be, we'll have to see what the long-term effects are, because we're still in the beginning of this,
Yeah.
But okay, on to the next one. Northern California, here we are. We're a very diverse region. Has there been any studies released related to underserved populations?
Yeah, there have been a number of studies this year that are worth people looking at when it comes to learning more about how Alzheimer's and dementia impacts underserved populations. But I thought I'd highlight one specifically, looking at the transgender community. AAIC this year included some of the first ever reports of cognitive changes specifically in transgender individuals. And of course, when we talk about transgender, we're talking about those who identify with a gender different from the one assigned to them at birth. And they also looked at what we call gender non-binary individuals. Those are people who identify outside of the male or female gender, binary gender. So this study came out of Emory University, and they looked at data which we call BERFIS here at the Alzheimer's Association, and our policy folks are familiar with that term. And it's an annual survey. It's called the Behavioral Risk Factor Surveillance System. This is an annual survey that looks at all kinds of chronic diseases across the country. And they were able to glean data from that information. In fact, in both California and in Nevada, our policy teams have worked really hard to ensure that questions within that annual survey get asked around caregiving, get asked around cognitive impairment in the household. And so sort of a little shout out and hats off to our policy team who work with policy folks at the public health folks at each of the states to ensure that we're represented in those questions. But Emory was able to glean some information from that around transgender adults and found that transgender adults were nearly twice as likely to report subjective cognitive decline. So what we mean by that is their own feeling, I feel like I'm not as cognitively intact as I was this time last year. And they were more than twice as likely to also report subjective cognitive decline related to functional limitations. So things like reduced ability to perform well at work or be out in the community volunteering or being social with other people. And then in Wisconsin, a team from the University of Wisconsin used the same data set and found that depression was significantly higher for transgender and gender non-binary adults, 37%. Compared to cisgender adults, so those that would identify in those male or female terms, it was only 19.2%. And we know depression is a risk factor for dementia. So these are, we also know that there are greater health disparities and for transgender and gender non-binary individuals. And so these are all additional risk factors. If there are health disparities, then kind of like we were talking about with the prevalence, then they're not going for annual checkups if they don't feel that they have a support system within the health system. It's going to put them at a higher risk for cardiovascular disease, for depression, for diabetes, all of those things that have evidence behind them to show that they increase our risk of developing dementia. So I think it's, it also really ties into that, the potential experience of greater rates of discrimination. We know that's a barrier to accessing healthcare. There's no evidence to suggest that gender reassignment surgery or taking hormones increases your risk of developing dementia, although both of those can have an impact on the brain. These studies were really more about accessing healthcare around risk factors and really around that self-reported feeling of cognitive decline. So it's a really interesting study. It shows that we need more research. I think a lot of what we learn at AAIC shows us that we really need a lot more research in some of these areas, but it also illustrates that need for access, right? There's a great need for healthcare that is culturally competent to address the needs of aging transgender individuals and their loved ones, so that they can get the care that they need. And at the Alzheimer's Association, of course, we've been partnering with SAGE, the Advocacy and Services for LGBT Elders, to help support LGBT people living with Alzheimer's or other types of dementia, as well as LGBT identified caregivers. And so there's some publications that have come out with some recommendations, and you can find some of those at alz.org for those details. But we're really proud of the work that we do here within Northern California and Northern Nevada with partnering with the SAGE organization.
Yeah, absolutely. I mean, it's such an important piece of the puzzle, and having this first of its kind study only helps to emphasize that point. So yeah, hopefully there will be some more research into that in the future. So we get questions often about reducing our risk of developing Alzheimer's or other dementias. Has there been any research shared this week related to risk reduction?
Yeah, there's been some new stuff that we've seen in the past, the need for things like cardiovascular health, for exercise, diet, all of those fun things that everybody loves to talk about. And we can talk a little bit more about that. But what really we saw this year was a continuation of some early studies that came out last year that talked about air quality. We've known for some time that air pollution is bad for our health, including our brains. But what we learned this year is that the data was some of the first to suggest that is not just about bad air quality, but what does improving air quality do to reduce our risk of developing dementia? And so through these studies, it showed an association, not specifically definitive proof, but they were conducted in large studies, study populations, which is always important. You know, we say that about research. Research is about science and evidence, and that evidence has to work in large quantities of people. It can't just be a study of 10 people. So this was a large study, but what it found was it underscored the importance to really look at reducing air pollutants. So thinking about some of those federal and local governments that are, and businesses that are working to reduce air pollutants. So this was the first time we've seen studies come out that don't just talk about what's bad in the air that's happening, but how if we changed it, we could actually see an improvement or a reduced risk of developing dementia. So there's going to be some more longitudinal studies that are going to be needed for this, for all kinds of communities, including those that have low and middle income countries that have those higher levels of pollution. But I think what it did was really illustrate that there are many factors across our life course that can contribute to the risk of dementia. And that also includes the environment. You know, some of these are going to be within our control, right? I just mentioned the fun ones like diet and exercise. Some of them are not, and are going to take everybody working together. And so what we can all do, any of us watching today, is the things that we can control. And that's why I'm always excited to be able to sort of throw in and talk about a little bit about US Pointer. So the US Pointer study is the study to protect brain health through lifestyle interventions. And we're participating, the Alzheimer's Association is running a nationwide study that I'm sure many of you have heard us talk about before, that's propelled by the finger trial out of Finland several years ago, that showed in Finland that lifestyle modifications can decrease your risk of dementia. And so what we're doing here in the US at 5 sites across the country, including UC Davis in Sacramento in Northern California, is we're testing that. We're putting together a trial that's in the middle of running now that will be able to demonstrate what kind of interventions can have impact on decreasing our risk of developing dementia. So if you're in the greater Sacramento area and you are over the age of 60 and you are not experiencing cognitive decline at this point, this is a study being done in people that don't currently have dementia, because we're trying to show whether or not we can reduce risks of dementia. I would recommend you going to alz.org/US Pointer and getting more information about how you might qualify for this clinical trial, because this is going to be the things that we need to do today to decrease our risk. And we saw several years ago the Sprint Mind study that showed us that monitoring our blood pressure. Michael, when was the last time you checked your blood pressure?
Well, I went to the doctor about a month ago. So yeah, and it was good. It was actually good. I'm doing good.
Great. So that's one step that everybody can be taking. If you have high blood pressure, don't be afraid to get it treated, because in the US and the Sprint Mind study, even people who had high blood pressure, as long as they treated it, they showed that decreased risk if they were kept at that 120 systolic level. So there's really, I mean, it part of it always feels a little bit like common sense, right? What's good for your heart is good for your brain. And we've been talking about this for so long, but yet there's still people that aren't aware. So if we can make people aware of the things that we can do, it's not going to stop you from ever getting Alzheimer's or dementia. We're not quite there yet, but we do know it's a step that you can take in the right direction to ensure you're decreasing your risks.
Definitely, yeah. And great plug for US Pointer there. And if people want to get involved, I was doing a little raise the roof there, because when you mentioned Davis, I'm based in Sacramento, so that's, you know, our own little backyard here. So yeah, I mean, it's just awesome what the association is doing in that field.
Well, and we have a great program, right, called Healthy Living for Your Brain and Body that you can attend online and go to alz.org/CRF to register for a local class. And it teaches you these components, talks about exercise and diet, what are the right foods to be eating, social engagement, and that cognitive stimulation, you know, that old use it or lose it. What are we doing to keep those synapses sparking? It's all real stuff.
Definitely, definitely. So yeah, you mentioned Healthy Living for Your Brain and Body workshop, and you also, plugged if they wanted to get involved with the pointer. But do we have any other tools to help folks that want to get involved with these clinical trials and studies?
Yeah, I think it's such an important thing to talk about because, while there's great research going on all throughout the country, there's still this big need to ensure that we have everybody represented in these clinical trials. And so there's never a day where we're not in need of participants for clinical trials. And so there's a great service that we provide at the Alzheimer's Association called Trial Match. And it's a matching service. It allows you to really find those local clinical trials that you might qualify for in your local community so that you can be part of the solution. And you can participate in those if you have Alzheimer's disease or dementia. There's some studies for that. You can also participate if you're a caregiver and you want to get involved in a caregiver study or just as a healthy subject for some of these other studies. So at alz.org/trial match, you can find the link to how to get involved and really learn how you can be part of our vision of a world without Alzheimer's and all other dementia.
Great. Yeah, definitely check that out, folks who are watching, if you want to participate. I think we're almost out of time here. We've covered a lot, and I think we've just scratched the surface. So, if folks want to find more details or more studies that are coming out of AAIC this week, or find our research throughout the year, how can folks do that?
Yeah, so I think I mentioned earlier the Science Hub app. If you have a smartphone, I highly recommend downloading. You can find it through Alzheimer's Association Science Hub. It's great. It's got all of the latest research. You can always find information on alz.org/research, or just call our 24/7 helpline, 800-272-3900. Follow us on social media. That's how you found us today. Share this information with other people that you know. Bring other people that might not think that they're at risk of developing dementia into the conversation. Because you know what? If you've got a brain, you're at risk for developing dementia. And so the more we can increase our concern and awareness about what's Alzheimer's and dementia are, what's happening that's in the research field, and what we can all be doing today to work together, I think the better off we're going to be.
Absolutely. That is a great way to end our little Facebook Live session today. So thank you so much, Claire, for joining us. Always so knowledgeable and able to, extrapolate and expand on all the things that are being talked about. And we really appreciate you joining us. And thank you, everyone, for tuning in. We hope you found this insightful, and we hope you check out all of the resources that we mentioned earlier. And with that, we will be signing off. So thank you again.